Are you someone who suffers from chronic pain that has lasted over 3 months? Are you waiting for your pain to go away before you go and live your life again? Are you tired of waiting? Have you tried many treatments, maybe even surgeries for your condition, but it seems to not get any better? Maybe your pain has even gotten worse? Then this video is for you. One thing that we can appreciate from the biopsychosocial model of pain is that our expectation of pain can affect its outcome in the long term. An article was published in the Journal of Pain, and this was titled "Expectations Predict Chronic Pain Treatment Outcomes" in 2016 was when it was published. And in the opening sentence of this article, they stated, both medical and psychological factors can have an effect on patient recovery. Let me repeat that. Both medical and psychological factors can impact patient recovery. So should we apply this kind of thinking to chronic pain? Do you think it applies here, the psychological piece? Well, in this article, they mention, quote, patients with higher expectations may be more motivated to comply with a treatment regimen shown to be associated with greater improvements. Okay, cool. Expectations also may affect outcomes by triggering a physiological response and by acting on anxiety to heighten or reduce symptoms. So it is therefore reasonable, they say, quote, to think that several mechanisms operate simultaneously to explain the associations between expectations and outcomes, end quote. So what do you think of these statements? Do you agree with them? Do you think your expectations, especially when it comes to chronic pain, affect or can affect your outcomes? Do you think your expectations can even trigger a physiological response, one that can even help or to increase or work against you, or decrease your symptoms? What many other researchers of like psychological studies, those of you who have studied this in school, you know about the brain and the power it can have, like your beliefs and expectations can have in just the real world living day to day, right? I mean, look at like placebo effect. People who think they are taking a medication that is supposed to work, but it's actually like a sugar pill, has reported, been shown decreases in symptoms for the thing that's even meant to treat, even for pain as well. So this tells us that our expectations can have a very powerful therapeutic effect on our pain. Just believing something works or is helpful for our pain can actually help to alleviate it. Some of you may be in the space, right? You believe that a medication is going to work, or a surgery is working, or has worked, or supposed to work, or you go and do some types of therapies or whatever. How come it hasn't worked then? You have expectation of it working. So this comes to show how pain can be very, very complex. And it's not only your expectation, but that is one component of it when it comes to treating your chronic pain. Your expectations for chronic pain, like your chronic pain condition, can even go as far as be associated with change in pain intensity. Well, why hasn't it helped you then, right? Well, it kind of makes sense though from a psychological perspective. If you have like a low expectation, just like very extremes we're talking now, right? For your condition, maybe like if you have fibromyalgia, chronic fatigue syndrome, low back pain, whatever, then you probably have lost some hope, and it may even affect how you feel in your day-to-day, right? Like your moods, if not your pain itself, right? So at the very least, it can affect your thoughts and how you feel, right? Now take the same person, maybe it's you, the viewer, and you may have a more optimistic outlook on the other side of the spectrum, higher expectations for your pain recovery. Now, I know we can't change, and you should know that you can't really change your thoughts or how you feel. These things just come and go. And if you're putting a lot of energy into like being happy, it may not be worthwhile because it just takes so much energy and ultimately it's not going to work. Instead, you may want to focus your energy on the actions that you can take, like what you can actually do or what you think you can do towards living the life that you want, living towards the fullest, most best life, right? So how powerful do you think your expectation can be on pain itself? Very powerful, right? In fact, many studies, they looked at patients who undergo surgeries for their chronic pain condition. And they like split this experiment into two groups of people. In the first group, they tell the patients nothing about their pain and how it will be like after surgery. And then in the second group, the providers, they tell the patients to expect some level of pain from the surgery for a little bit, but it would heal and over time they'll likely get better. So between these two groups, which group do you think had better perceived outcomes when it came to like pain? Actually, what they found was that the group that expected to have pain post-surgery, like actually did better because they were prepared for it, probably. They probably were less anxious, less fearful about the pain, and more hopeful about their pain in terms of expectations of outcomes. The other group, they had like no perceived expectations, at least that came from the doctor, how their pain would be. And when they actually felt the pain, maybe it's the old pain, or maybe it's the surgical pain, or maybe it's both, whatever the may be, they probably needed more pain medications. They didn't handle it very well. They experienced higher levels of pain, and they may even have lower levels of outcomes and lower perceived benefits. So no, I'm not telling you to go and sign up for surgery and have them tell you about how much pain you're going to have and then get, better outcomes. That's probably a last resort, and it's really a place for you and a time for you to have a conversation, separate conversation with your healthcare provider. But in most cases, I would say for the majority of cases, when it comes to chronic pain at least, like low back pain, neck pain, chronic fatigue syndrome, fibromyalgia, and others, all that can be probably treated without surgical intervention and instead using another approach, such as a biopsychosocial approach. And one way to attack these kind of complexities in treating the chronic pain is by taking different perceptions or having a different appreciation for pain or a different expectation for your chronic pain. And some of you may have really high expectations, really think things are going to work. Some of you may be on the opposite end. I know you can fall anywhere along the spectrum. So with that said, one of the challenges when it comes to making a health-related change for the better is to take small actions, right? An example is like weight loss, right? With continued committed actions like exercise is when we see results. And also our beliefs and expectations can have a powerful effect on our pain. What we do in the real world, in our actions and our behaviors, can have an even stronger effect. Researchers from the journal that I stated earlier, they found, quote, expectations are now regarded as a promising catalyst for change, and it should be considered an important factor in improving treatment success, end quote. Okay, so now with this information, you may be wondering to yourself, are you someone who has a low expectation of pain or a high expectation, right? We all fall on a spectrum. So healthcare practitioners, they often use like a scale to measure things, kind of like a self-quiz that you can take. So one of these is called the Pain Catastrophizing Scale, or the PCS. So go ahead and pause the video and answer these questions, maybe like on a piece of paper to tally up the total, or you could even do it on your phone, I guess, and then come back and watch this video for the results and how to interpret it. So you can pause it now in 3, 2, 1. Okay. So now you should have taken the PCS and scored the total for every single question. Make sure you answer each question and score the total. Here's how to interpret your score. If you score higher than 30 in total, more than 30, this indicates that you have high catastrophization of pain. People who score higher on this scale, who have catastrophizing about pain, researchers have found basically a relationship between catastrophization of pain and poor functional outcomes, such as higher disability levels, lower quality of life, more pain, things like that. So if you're one of these people who scored pretty high, then this may possibly explain your recovery and how maybe you've been slow for your chronic pain. But this is also hopeful as well, because it means that addressing your catastrophization, your fears and things like that about pain can change your perception and expectation for pain and increase your outcomes. So that's very, very helpful. Chronic pain is a complex phenomenon, and if you have even a low catastrophization, so those of you who have high hopes and stuff, you're not kind of like, screwed and out of options yet. This just means that now you can focus on other areas, such as on the biopsychosocial model, to focus on when it comes to treating your chronic pain. So you're on the right track, basically, is what I'm trying to say. Usually I would say if you found this video helpful, give it a thumbs up, but right now you're experiencing chronic pain, go and get some sunlight, go and do the things you love, take some small steps. And when your pain has decreased, you have healed, your chronic pain is better treated, come back and give this video a thumbs up, like it, subscribe, and share this with other people, friends and family who are experiencing chronic pain so they can help provide support and help them recover. So thanks for watching and have a nice day.